Hello, Assalamu alaikum. Welcome to another episode of Health is Wealth. I am your host, Shabnum Riaz. So today we're going to talk about dental health, the health of your teeth, your oral cavity, and also something that's really interesting is we're going to talk about your smile. Now, how many times have you heard information about what your smile is like, and do you need to get your smile corrected? Is there anything you have to do about it? How can you feel better about your smile, amongst other things? So we're here today and we're going to talk to Dr. Awais Rabbani, who's dental surgeon and an expert in his field, and he is going to give us all this information that is going to be really important. So let's go and have a chat. Okay, and here we are inside the clinic, and we're very happy to talk to Dr. Awais. Dr. Awais, thank you so much for joining us here today.
Thank you for calling me, Shabnam.
Thank you for inviting us to your lovely clinic, and you know, it's a very, very vibrant place.
Yeah.
But I must admit to you one thing, a confession. Dentists just scare me to death. And dental procedures. We just walked through the door and I saw the dental chair and I saw other things. I thought, I'm so glad I'm just here to record a program. Do you get that a lot, the dental phobia? Do you get that from patients? Is it a common thing?
Shabnam, whenever you think of a dentist, you know, when I myself, I'm a dentist, and if I think of going to a dentist, to the same feeling I'm going to have as well. And that is because of the thing that what we call is that we are going to do some intervention. When a patient is going to come to us, what we are going to do is we are going to do some physical intervention to make that patient go comfortably home. But that intervention, when we talk about the intervention, so the patients, they are always apprehensive. They lack the confidence that what the doctor is going to do with us. Despite of the fact that whatever we are going to do, we will make sure that the procedure is absolutely pain-free. The patient goes pain-free. But the thought in the mind that what the dentist is going to do with me is a little scary. It is. So the phobia will always stay there.
Okay,
I think it should. And
I think it makes a lot of difference about the dentist and the dental team who are treating you as well. Their sort of the way they handle you and everything, as they say, the bedside manner.
Absolutely. I would just say that, you know, being a dentist is it's more of a teamwork, because when we are working, so we must, I have one assistant with me, one or two assistants depending upon the procedures what I'm doing. So it is entirely dependent upon my team. So I am the main guy. The dentist is the main guy who's doing the core work, but he is dependent upon the people associated with them. So I would call every successful procedure is basically a teamwork, I would call it.
Right.
So a team, you know, is going to make the procedure go well, depending upon the case, you know. And then we'll talk about that there are different procedures. Like when we talk about being a dentist or you coming to a dentist, so there are different procedures we do. We
depending on what the patient needs.
Absolutely.
Absolutely.
Yeah.
Okay. So when we had a conversation before recording the program, there were some things that you mentioned that I thought were really, really interesting. For example, you mentioned something called a smile line, and that's something I never ever heard about, and it seems very, very interesting. Tell us about that, please.
Well, like they say that, you know, the eyes is the windows to the soul, so I would call that, you know, a smile is the window to the personality of any person. Whenever you meet somebody and, you know, meet and greet, what we call is, so you always have a smile. So the first thing, you know, the noticeable thing, they are the teeth. So then the smile I would call is the most important thing in a personality of a man or a male or a female or whatever you call it. So what is the smile line? Smile line, basically when we talk about smile is the number of the teeth which are shown when you open your, you give a smile to someone.
When you give a smile.
When you give a smile, so the number of the teeth which are showing. So we call it that it's a 6 teeth which come into a smile. There are 3 on the right side and the 3 on the left side.
Okay.
You know, that is the smile line.
That is
so for a smile, those 6 teeth, they have to be in a perfect condition.
Right.
No matter something is happening with the posterior teeth in the mouth, but for the smile, those 6 teeth, they have to be in a perfect condition. Because
Okay.
that is the first noticeable thing. You know, you think about somebody who is giving a smile and he or she is having a missing tooth in the oral cavity.
Oh, yeah.
So there's going to be a big window open. So
And
that-
your attention,
and
while they speak,
Yes.
your attention will be all the time on that missing tooth.
Absolutely, you know,
Yeah.
and the people, we being a dentist, you know, we always focus on the smile. Okay, when we talk about smile, I would one very interesting thing I would talk about is it's the midline of the teeth. You know,
Okay.
when the smile of the teeth, when you see when we see a patient smiling.
Hmm.
So first of all, what we notice is the alignment of the teeth.
Okay.
Then in a smile, the number of the teeth,
Mm.
then the color of the teeth,
Mm.
and then there is one very important thing which is the central midline. At times when we talk about the patients who have malaligned teeth, the teeth are not in alignment.
Mm.
So in those teeth, the central line is on. You know, it is deviated on the right side or the left side. You know, we say being a doctor that human being is bilaterally symmetrical. You know,
Mm.
if you cut somebody, a human being, everything is just going to be split into a half.
Mm.
So if you make a line which you know which make the symmetry of a human being,
Mm.
so a line should absolutely align coming in the middle of the face.
Mm.
So sometimes you know the smile line is on as well. So we need to see that smile line is right or left.
Okay.
So in certain cases, specifically in females, you know, they're more conscious of the smile. So we at times we treat that smile line as well.
Okay,
So the
so
smile-
if there is that thing you mentioned, that a right or sort of a left deviation, how is that treated?
So we have different procedures we do in that. Like if somebody, so you know, there are different treatments for patients. There are certain patients, they come to us and they say, doctor, we have teeth, we have malaligned teeth. So their teeth are crooked. They are up and down on right or left. And then the other side of the patients, we have spacing in the teeth. So the patient is having one teeth here, and then there is a gap between the other teeth, and the second teeth lies on the other side. So then depending upon the cause which is causing that line not to be in the center, we treat that cause. Either we take a tooth out, or we put another teeth in the mouth oral cavity just to fix that line.
I
So
see.
this is what
right.
we do. But it
Okay.
depends upon the patient.
Okay,
Patient, yeah.
right. And would braces, orthodontics, would that play
Absolutely.
a role
absolutely.
there as well?
Absolutely. When you know the patient, they come with a crooked line, when the teeth are not aligned, so we go into an orthodontic treatment. We put the braces upon the teeth just to align the teeth. So that is what the treatment happens then.
And that would help so much with a person's confidence.
Absolutely.
I would think that, you know, because many people sort of avoid dental treatment because they don't exactly know what's going to happen. They might have spent their whole life not smiling properly, being very, very conscious of that. So this is something that can be treated at any age?
Shabnum, a very important question. I think I must say this, that the most important thing while you want to go to a dentist is going to a right dentist, and then knowing what your problem is, and then going to the right person to get it treated and get it fixed. So that
Right.
is the most important thing. And when you go to a right dentist and for the right cause, I think your problem will resolve.
Right.
It would be rectified. Yeah.
Right, okay. So that would not be an issue, so you can get that done at any time.
Absolutely.
Okay.
Absolutely.
Another really interesting thing that you mentioned was a gummy smile. What's that? Sounds very cute.
See, our teeth, basically the structure of the teeth, they are composed of the teeth, and then there is a gum show as well. You know, the gum line is the gum portion of the tooth which lies between two teeth. So that is the gum show. And we say that normally when somebody smiles, so the gum show is like 2 to 3 mm.
Okay.
Very, very slight.
Very slight.
So then we have patients, I think people must have seen them, you must have seen them, when they laugh, so
Oh, yeah.
the gum show is a little more than 2 to 3 mm. So their gum show is like more. So in the patients, we call that a gummy smile.
A
When
gummy
somebody
smile.
laughs and the gum show is more than like 5 to 6 mm,
Okay.
so that smile is a gummy smile. That is a mixture of the teeth and a lot of gummy show,
Okay.
which should not be there.
Okay.
So we can rectify those problems as well. In the
how is that rectified?
Well, then, you know, at certain procedures, you know, what we do is at certain times we camouflage a problem.
Uh-huh.
And at certain times when we have patients with class 3 cases, so that cases will end up into orthognathic surgeries. So that they are long procedures. But in certain times we camouflage the procedures. We camouflage the smile, and we try to focus on the problem with which the patient is coming.
Okay.
We can do that. So there are different procedures we end up doing in that.
Sort of in if we take back about like 30, 40 years, and now with so much advancements in technology and the way things are done, lasers and whatnot and everything, would you say that it's easier being a dentist and being a patient? Is it now easier to get problems fixed?
Shabnum, me being a dentist, I'm working in the dental field from the last 10 years. So I can very, very well, compare things which were happening like 10 years back and now. I would say that the dentistry right these days is much easier because of the advancement and the new technology which has just jumped in our field, like the X-rays, like the CBCTs, the 3D cone beam X-rays, and then the laser procedures. They have made the procedures end up into a much better prognosis, I would call it. So the things and the treatments which were done 10 years back were not as up to the mark as they are these days. And that is because of the advancement in technology, I would strongly say that. The quality of the materials which are coming these days are much better than they were previously. We have if I talk about, previously whenever you used to talk about the permanent fillings, so we were only looking into those amalgam fillings when somebody is laughing, so you can very clearly...
The silver ones.
The silver ones, we can very clearly demarcate.
Yeah.
So we had, the tooth colored filling materials then as well, but the quality of the tooth colored materials which we have right these days, they were never there then.
Okay.
So they do play a better role, in the prognosis and then the diagnosis and then the treatment, I would call it. Yeah.
So aesthetics now, people are becoming more and more aware of not just, pain in their teeth or having a filling or whatever, but they're very, very aware of what their teeth look like. So stains, discoloration, what types of stains are there? What types of discoloration are there? Why are they caused, and what is the treatment?
Well, you talk about aesthetics, the amount of awareness people have these days was never seen before. I would just, being a dentist, a lot of people, they come to me, and they come to me not because of their treatment, because of their aesthetic treatment. They would say that, Dr. Sahab, I have, the stain on my teeth, they are crooked, they are not in shape. So aesthetics, they have a lot to do these days. So when we talk about the discoloration, I think the most important question is the discoloration on the teeth, because they are the most visible part.
Yeah.
When you talk with friends, when you're sitting with your relatives, with your friends and family, outside, and especially with somebody like you who have a lot of media exposure. So, they are very conscious. They should be, I must say. So people, they ask me that, Doctor, what are these stains made up of, and why do they happen? Why they happen? So I always tell them, I start with, tea. I start with coffee. Tea.
Oh,
coffee.
We are a nation of tea drinkers.
Absolutely, a lot of tea. And then I say there is
coffee as well, you mentioned.
Coffee as well, and then different chocolates, I would call it.
Oh no, these are all the good things in life.
They are the good things. And they say every good thing, they have the side effects as well. So, and then we talk about the sweet rice zarda, which is cooked in every house, in every household it is being cooked. So that is a discoloration. So everything, Shabnum, if you see what we consume in a daytime, starting from your breakfast and then your lunch and then your evening tea and then your dinner, so everything has a discoloration. So those discoloration, they do have an effect upon the teeth.
So do we need to have these things in moderation? Or even if you're just, say 3 cups of tea a day, would that?
See, no, I would not say that, in moderation. If somebody is having tea, I would just like to have tea after every patient I have, it's like a strenuous job. So I would just strongly recommend that everybody, must see their dentist, irrespective of if they have a pain in their oral cavity or they do not.
Thing.
And the main reason for going to a dentist is that if dentistry is basically prophylactic. You need to stop something from happening, first of all. If you stop something from happening, so you do not end up into a lot of trouble.
Right.
So if you go to a dentist, and then, we were talking, before the recording started, that there are 2 types of stains. One
Yeah.
stain, if you rub that stain, you can remove that stain. But the stain which is unrubbable, if you cannot remove that stain, so that stain is not a normal stain.
Okay.
That is the problem with the tooth decaying. Yeah,
Oh.
you call it a caries. So
Okay.
you have to differentiate between a stain which can be removed or which
Okay.
cannot be removed. The one which cannot be removed is basically caries. And the caries, once it starts with the tooth structure, so you cannot do anything about that at home, or there is no remedy at home. You know, you cannot. You have to go to a dentist. And then they say in English that a stitch in time saves 9. If you go to a dentist well in time, so you won't end up into a bigger procedure, which is, you know, the caries ending up and
True.
making an exposure into your softer part of the tissue. We'll talk about that
Absolutely
as well.
true.
So
Absolutely true.
if it happens, you know, if the caries process, it reaches your nerve, so then you end up into a procedure which is
That's
a
right.
lengthy procedure.
And
which is
then that
normally known
is
as the
usually
RCT.
99% of when people come in to see the
Yeah,
dentist,
exactly.
unfortunately.
Unfortunately.
Yeah, which is something that we're hoping to change with this program. You know, you can see that Dr. Awais is such a friendly dentist. So if anyone has a phobia or whatever, I'm sure he'd put you at ease. I think that's the main thing. Okay, while we were talking about aesthetics, I was thinking, have you ever had a patient come in who just wanted aesthetics done, but you saw something that was more alarming with their teeth, and you said, hello, okay, sure, we'll get this done too, but this other work you have to get done. Have you ever had that situation?
Shabnum, this is a very common problem, you know, whenever patients come to me, and, you know, we being a dentist, you know, always looking into teeth,
Right.
and when a patient comes and, you know, I myself mark the patient. And I am the happiest dentist when I see somebody, you know,
With
with
good
no
teeth.
caries. Yeah.
Wow.
Yeah. I had a patient, you know, she was 70 years of age, and she came from all the way from London. And
70.
70, yeah, she was
Wow.
70. And I must confess that she even had her the wisdom tooth in the oral cavity,
Wow.
and none of the teeth had the dental caries. So
Wow.
I had to appreciate that patient.
What was her secret? What?
The secret was that she was paying a regular visit to the dentist.
That's it.
So you asked the
That's
question about that. It always happens when the patient comes, when the dental caries. The problem with the dental caries is it is painless. Nobody
you
is
won't
going to
find
have a
out
pain. I
until
must
it's-
tell everybody who's watching this program that whenever why is it important to go and see a dentist? That's important because he's going to detect whether do you have a caries in your oral cavity or no.
Something
And
that's about to happen and get worse.
Something which is about to happen. Okay, what
Right.
happens with the caries is, I always talk about that. I always tell my patient that whenever you have caries in your oral cavity, you are never going to feel pain. But when the pain happens, so, okay, when you don't have pain and you go to a dentist by chance and the dentist see,
Yeah.
so what has happened, he's going to do the filling of your teeth.
Right.
He's going to fill your teeth.
And stop it
with-
there.
Stop it
Stop
there
that
and then.
decay there.
And stop the decay there and stop your tooth from going into a non-vital condition after you end up into an RCT.
Yeah.
So you know what happens? You have less pain. It is less upon your pocket. I must call it, filling will cost much less than an RCT, and then finally ending up into a crown or the dental prosthesis. So that's why I always tell my
this
patient-
sounds like the story of my life. That's why I can so relate to this. That because of not going to the dentist, because of the pain, and then not going because of the the phobia and everything, so I wouldn't go get the checkup. If I had, I would have saved so many of my teeth.
I tell you,
Yeah.
Shabnum, and I tell all my audiences and the people who are watching me right now, please go to a dentist.
Oh,
Just
yeah.
one very fine morning when you
Yeah.
have nothing to do,
Just
just
go.
wake up, give your dentist a call,
Yeah.
and go to him.
And they will not do anything, without your permission. So if that worries you, it's okay. But the best thing here that we have determined, I'm a life example as well for this. Do not do what I did. I would not go for my regular checkups, and so always ending up in pain and always being told, okay, now this is either a root canal or it's an extraction.
Yeah,
Which is such a sad thing actually, when
It
this is all preventable.
This is absolutely preventable.
Yeah.
But I would again call that it all depends upon the time. The right time if a patient happens to be in the dental clinic. So everything can be saved. Everything can be saved and in the proper manner. And I must tell you, Shabnum, here that there can be no substitute for a natural tooth,
Absolutely.
which Allah subhanahu wa ta'ala has given everybody.
Yeah.
The dentition, there can never be we have substitutes. We have dental implants, we have all the procedures in the mind.
But
we can
why
put on.
not avoid all that?
Why not? And when these problems are avoidable.
Yeah.
And avoidable how?
Yeah.
When you go to a dentist in time.
Exactly.
You go to a dentist in time, save your tooth, save yourself from ending up into a disaster one night when you wake up with a
Oh no, that's
bad
the worst
toothache,
thing
and then
ever.
a lot of
Yeah,
problems
yeah.
which can happen.
Okay, now let's talk about the very beginning of teeth development, babies.
Yeah.
Baby teeth, or milk teeth as
Yeah.
they're usually called. Many people, parents, families, don't understand the importance of milk teeth, looking after them, because young children will have a lot of candy, a lot of sweet things, a lot of, parents usually do not check on the brushing routines. Tell us
Absolutely.
about that. When is the first time a baby, even a child, should have their teeth brushed?
Well, a very common and a very important question, and I must say that people do not have the level of understanding which they must have, especially the mothers, about the condition and about the importance of the baby teeth. I must talk about that. Shabnum, the first ever teeth which comes into a mouth of a baby is like, it's in between like 4 to 6 months time. The first the teeth will come, and it's going to be the lower A, we call it.
Okay.
The lower A, the central incisor.
Right.
And the parents are going to be amazing, the first teeth
They're going to be
come.
so happy.
Yeah, they will be.
Teeth.
And then this process goes on and on and on.
Right.
And the first teeth which comes up, the permanent teeth, with that will come up at the age of 6 years.
Oh,
6
okay.
years. So a very important question here, whenever patients come to me, and whenever the mothers, they come with the children to me, and whenever I see a 6-year or a 7-year-old child in my clinic, I tell those mothers that you have to be very conscious about one thing, and they say, what is that, Dr. Saab? So I tell them that your child is 6 right now, so the teeth, in the lower teeth and the upper, the last teeth in the lower and the upper oral cavity, they are the permanent teeth. Because the first permanent tooth, it comes at the age of 6.
Yeah.
So from 4 months to the 6 years of age, all the teeth are going to be present in the oral cavity. And from 6 years onward towards 12 and 13, we say that's a mixed dentition stage. Okay, we talk about the deciduous teeth. When at the age when the teeth, they start coming into the oral cavity. By the time the teeth start coming into the oral cavity, their care should be taken.
Okay.
Because the structure of the teeth, if we talk about the structure of the teeth, so we say that broadly we define it into, there are the harder part of the tooth and the softer part of the tooth. The harder part of the tooth consists of the enamel, dentine and cementum, and the softer part is basically the connective tissues, the nerves and the blood supply, and that is the nerve of the tooth.
Okay.
So we must say that the damage to the harder part of the tooth, which is known as the enamel, which is known as the caries, we have to stop that from happening. So stop that from happening. So when we talk about stop that from happening, we talk about we are marking both the tooth, the deciduous tooth and the permanent tooth. So the mothers which are having the babies and they have the tooth in their oral cavity, they must take care of their teeth by brushing, by rinsing the mouth. When we say when we have the smaller child come into my oral dental clinic, so the mother asks, how can we take care of the teeth of the baby? So we always tell them, you have to make sure that babies, they do not consume a lot of sugars before they go to bed. And even if they do it in the daytime, you must make sure that you rinse their mouth. Even if they cannot do it, you must do it. Take a little water, put it in the oral cavity, do a little swishing with your finger if the baby cannot do it, and make sure that nothing stays up on the teeth. We talk about the chocolates and the candies these days, and the processed foods and the processed sugars. They are more dangerous these days the way they used to be 10 years before.
Okay.
Because the processed sugars, what they do is the stickiness of the processed sugars, they increase with time. So when anything, and especially the sugars, when they stick on the teeth, they are the most harmful thing for the teeth. They will decay the tooth, they will damage the harder part of the tooth, making a carious process on the harder surface, and then ultimately the process is going to start and end up into the procedure extraction and RCTs. So the importance for the baby teeth is as important as they are for the permanent teeth.
Okay, for older people now, flossing, that's something we do not see a lot of in Pakistan.
Shabnam, we're talking about the teeth and their health. one very important aspect, I always tell my patients, and when they come over, that people, they are aware of their teeth more these days as they used to be like 10 years back, I must say. They are aware of it. But one thing they are less aware of these days as well is their flossing. They do brushing, but one thing which is important is flossing. And why is flossing important? That whenever you consume meat, and you have barbecue parties and you have the consumption of meat, though meat have fibers, meat have small fibers, and when you chew your meat, some fibers or some food, they get stuck into the interdental area of the tooth.
Right.
So something which gets stuck in the interdental area of the tooth will never come out with brushing. Will never come out with brushing. And the person might be unaware of that thing, that something is inside the interdental area. So to make sure that the things, they do not stick in the interdental area, you must do flossing. And I must say to all my patients that a floss is something which we seldom don't have in our washrooms, but we must have floss in our oral cavity. Whenever at night time you go for brushing, everybody does that. You must do a little flossing as well, and the mouthwash and
and develop that into a proper routine.
Absolutely, because that is critically important.
Yeah.
At times patients come to us and we see there is no cavities. From just the visual aspect, we see and there are no cavities. But when we do the X-rays and we see that there are caries, which is known as the interdental caries, caries in between the two teeth.
Okay.
And that is what happens when you do not do the flossing.
Right.
Because something which is stuck inside the tooth will never come out with brushing.
Okay.
So that is why the flossing is critically important. You must do that. I strongly recommend.
Is it true that more teeth are lost through gum disease than tooth decay? Is that true?
It is absolutely true. You can say that is true as well, because there are certain people, they come to me and they come to the dentist with gum problems. And when they come and when somebody comes to me with a gummy problem, because teeth are inside the bone, and the bone is covered with the gums.
Yeah.
So when somebody have a problem with the gum, which is normally known as gingivitis, I was long time back in 2006 or 7, there was a Guinness Book of World Record book, so I was just reading that book, so there was something of my interest, and that time I was in my dental college, and that was that the most common disease of the year 2007 is gingivitis.
Oh.
99.9% people are suffering from gingivitis. It's the inflammation of your gingiva, and people they will go unnoticed because they won't be having any pain. But the gingivitis. So if gingivitis happens to somebody, and then it proceeds on, it lingers on into a chronic gingivitis, there's something which we know as acute gingivitis, and then chronic gingivitis. So if the gum disease, it proceeds on, lingers on, it ultimately will end up, into shaky tooth, and then teeth can sometimes come out as well.
What are the signs of a person having
gum disease? The first sign is, the color of the gingiva.
Okay.
The color of it's going to go into a little more reddish,
Okay.
It is going to more go. And the second sign is that whenever you brush your teeth, when you swish it, and you're going to notice that the small stains of blood, they are coming out when you do swishing of switch with the water. So they are the sign.
Right.
And up early in the morning, you might have some blood stains upon your teeth. And one thing which is known as halosis, the bad breath, that can happen as well. So before all these teeth problems happen to somebody, must say, a visit to a dentist is a must.
Okay, so what should a person, if they have bad breath, how can they help that? By coming to the dentist, other things as well that they can do?
A bad breath or halitosis, when we talk about that, it's a vast topic, because the reasons for halitosis, there can be multiple reasons for halitosis. All the way, happening something into your oral cavity, and then into your, some gastric issues, but mostly the problems are into your teeth. Either you have bad breath because of the gingivitis, it's very, very common, and then you have some decaying process in your oral cavity. The halitosis can be because of that. Then I must say that whenever the patients, they do brushing, at the end of the brushing, it is a must that they must brush their tongue as well.
Ah,
Yeah.
now there's something that many people don't do.
They must do that because
Ah.
these days, I might be having, when you go and, these days you go and, shop for your toothbrush. So the brush have on the backside of the teeth, they have something, a small serrations on the backside of the tooth.
Tongue scraper.
And the tongue
Yeah.
scraping.
Yeah.
So you must do that tongue scraping as well. Because, halitosis can be because of that.
I see.
So it can be because
That's something you should do morning and evening with your
no,
brush?
no,
routine?
at whenever you do brushing.
Okay.
Whenever you do brushing. Mostly
Okay.
the people, they do brushing when they go to bed and when up early in the morning,
Right.
So whenever you do that, it must be a habit. Everybody must make that a part of their brushing techniques to brush their tongue as well. And then use of the mouthwash and, certain things like that. It will prevent you from, having halitosis or somebody developing the halitosis.
Right,
Yeah.
okay. How do you treat gum disease?
Well, gum disease, first of all, the most important thing in gum disease is, the brushing habits, must call it.
Okay.
Whenever people do brushing, I always, do a lot of stress on the way people brush. I must tell you, through your program, Shabnum, that the toothbrush is basically for your teeth, the hardest part of the tooth, the harder part of the tooth. They are not for the gums.
Oh,
And the gums, when we talk about the gum disease, we say that, when the gum disease happens, so the gingiva, it starts to recede.
yeah.
The gum
Yeah.
recession happens. The gum, the gum recedes, and the amount of the gum, it becomes less. So whenever you do the brushing, it should be in a proper way, and to stop yourself from happening into a gum disease, you must do proper brushing.
Okay.
Proper brushing, and then the use of the medicated paste sometimes. So not always, I would not recommend using them always. And then
Okay.
the use of the mouthwash and flossing, and the generalized tips for the oral cavity which you do will prevent somebody from ending up into a gum disease.
Right.
Yeah.
Any illnesses that can cause problems to your teeth, like being diabetic, I don't know, hypertensive, any of these diseases, do they also play a part? Should a person with these diseases be more careful?
Shabnam, I would call that, the collaterals, they do happen. They are a part and parcel. And when you talk about diabetes, the most I would call the debilitating disease, or I would call the worst disease is diabetes. The amount of the sugar level in your blood, when it raises up, it will affect every part of your body. And the gums, being a softer part of the tissue, are absolutely affected. Absolutely affected. Somebody who is having a problem with the tooth, or even not having a problem with the tooth, if he or she, have the diabetes, it will ultimately affect the tooth.
Right.
It will ultimately affect the gums. It will ultimately affect the oral cavity. A person, have diabetes. We always talk about, when we talk about the halitosis, the bad breath. There is a typical, bad breath which happens if somebody is having diabetes.
Is that ketone smell?
Exactly.
Yeah.
Ketone body, the
Yeah,
ketone
okay.
smell,
Alright.
and it ultimately definitely affects. So the sugar, there are patients, sometimes they do come to us and they say, the doctor, this thing is not even healing. You have given us the medicines, and we
Yeah.
are taking the medicine from the last 1 week, and
Yeah.
the problem is not, healing, or this disease is not going away. So ultimately, the first thing we focus is on, we say that you must go and you must do this diabetic test.
Right, okay. So,
Because the blood sugar is raised, the problem, it will take a longer period of time, and there are chances that it might not heal. So this is very important, and this is very critical, that the blood sugar must be controlled.
controlled, yes,
controlled, yeah.
must be in control. Okay, so we have some models here, and they look really sort of like technical and everything.
Yeah.
So tell us about them.
Well, that's the model I must call them, if the camera comes close to me. These are the basically models to tell somebody about the dental implants. Whenever whenever a patient, there are chances that somebody loses a tooth.
Right.
It always happens, it
Right.
can't be because of a trauma or a sports injury.
And are these only for the molars, or for the
No.
for all the teeth?
No.
Okay, okay.
The dental implants can be placed on any missing tooth.
Okay.
The root of the dental, the dental implants can be placed in the anterior area, the posterior area.
Right.
When we talk about the teeth, the central teeth, they are known as the incisors, and then we have the canines, and then we have the premolars and the molars. So any missing tooth can be replaced with an implant.
Okay.
So what an implant is, these models basically, we have a molar here,
Right.
and this is the crown part of the tooth, and then we have a premolar here, and then we have a canine here.
Okay.
So these basically are the tooth. They are showing, the dental prosthesis.
Right.
Whenever a patient has a missing tooth,
Right.
so either we do a RCT or we do a prep, a bigger part of the tooth is missing.
Okay.
So what we do, we put a dental crown up on the teeth.
Okay.
So these are basically the dental crowns.
Okay.
You see, we make a crown, we make a prosthesis, and we make up like this.
Right.
But the dental implants, basically, they are the titanium implants or the zirconium implants. They are the noble.
And there's no root there because the tooth is gone.
Well, the dental implants, they will only replace the root of the tooth.
Okay.
So whenever, these days, we do not extract the tooth. It is, being a dentist, I would call it as criminal for me to remove a tooth. I will do my utmost try to save any tooth.
Yeah,
from
because
getting it
I've
out.
noticed
Yeah.
that dentists, the
They
main
know.
thing they say, and it's like, for them it's a personal
For,
loss.
for me, if I, I do a lot of extractions every day.
Yeah.
So I am not the happiest man when I'm doing the extraction.
Yeah,
I do it every
yeah,
day.
yeah.
Because for me, losing a tooth is like not very, it's not a happy moment for me.
Yeah.
So, so whenever we lose a tooth or we remove a tooth because of a disease problem, so we have options to replace the tooth.
Okay.
So the first option what we have is we put a dental implant. We put a dental implant, and then on the top of the implant we put a crown. So that's how we replace the tooth.
Okay.
So if the whole the complete tooth is not removed or the root is intact, so then we have certain other procedures to save the tooth. We can
Okay.
put, by putting the pins and the posts up on the tooth.
Okay.
We can do the core build-up and then put the crown up on the tooth.
Okay.
So dental implants, they are placed when we completely lose the tooth.
Okay. There's
Yeah.
no tooth. It's an empty sort of
Empty
a socket.
and when we remove the root of the tooth.
Okay.
So we put a dental implant, and then just to do the prosthesis and just to have the place where we are going to put the crown up on the tooth. That's how we do it.
So this is surgical and non-surgical. There are two types of dental implants, or what?
Basically, when we talk about the implants, they are surgical implants.
Okay.
But we normally do not have the non-surgical because when we are putting the implants, we are doing the surgery in the mouth of the oral cavity or mouth of a
Right,
patient.
right.
So they are basically surgical procedures.
Right.
We do
And
it with
how
the-
long does this process take? Is it a very long one?
It's
Is it-
it's not a very lengthy process. It's like I must call it that taking a tooth out is a bigger problem than putting an implant.
Oh.
Putting an implant is
Okay.
yeah.
All right.
Comparatively, it's a simpler
So
process. than
a simpler
putting an
process. Okay, Dr. Awais, something that we were talking about before the show sometimes is something that you were telling me that is very popular nowadays, and also something that makes a huge difference when we were talking about aesthetics as well, and that is teeth whitening. So we've got some visuals here that we're going to look at, and can you just talk us through the procedure of exactly what happens when a patient comes in to get teeth whitening done?
Yeah, well, I think, just coming back to the smile, when we talk about the whitening procedures, we always talk about the smile. How can you make your smile more brighter and, more smiler and, a sunny shine, we call it a sunny shine smile. So we do the whitening procedures most of the time, what happens is that the color and the hue of the teeth, with passing age, it doesn't stay that white.
Right.
It starts getting a little yellower and the shade gets more, it goes towards more of a yellowish tint. They don't stay that white. And even in the patients who have slightly not more whiter teeth, so those procedures are indicated for all those patients.
Okay.
So basically this whitening procedure is a very safe procedure, I must say it, and it's a clinical procedure of like 40 to 45 minutes. What we do is we see the patients who lie in the category who go for the whitening procedures.
Okay.
Those whose smiles are not that white.
Okay.
So what we do is, we do have multiple kits, we do that. That's the procedure in how we do the whitening is, it's basically an oxidation procedure.
Okay.
We give oxygen to the teeth. So that's how, we we take the color from. When we talk about the whitening procedures, mostly, it is to make your smile more brighter and more shinier, and the whitening procedures these days are very common. They are a part of the aesthetic procedures, I must call them. And a lot of patients, mostly females and the males, they come up to us and they say that, Doctor, how can we improve our smile? So the first thing we always tell them that you must go for the whitening procedure, which is a clinically based procedure, a very safe procedure. And what we do in whitening is that we make the teeth, the color of the teeth more whiter and more brighter.
Okay.
And how we do that is, the process is known as oxidation process.
Okay.
It's just oxidation process. And as the patient comes to us, he's just seated up on the chair, and then first of all we take the shade of the patient. Depending upon
the shade that their teeth is that we can see right now.
Exactly.
Okay, that
so,
thing, the picture that we can see right now.
Exactly. The videos you can see right now.
Okay.
We mark the shade, either it is in an ascending order, either it is 4, 5, 6, depending upon how white the teeth are.
Sorry to interrupt you. Do you decide what shade you're going to, how far you're going to go, or does the patient decide?
Yeah, it is with the patient as well.
Okay.
The patient can tell us, I want to come up on this level, or I want to have this shade with me. So it is with the patient as well, and we can do that. It is what we can do.
Right.
And mostly what we do is, the shades, when we do the whitening procedures, they're very successful procedures. I must say them. As my audience, they are just going to see right now that the shade it is going to go almost like 4 to 5 shades in a higher tone.
Right.
They are going to go,
so we can see
from,
that.
From 6 to it is going to come up to 2 or 1, and the patient's smile is just going to be
I think
very
they're going to be
white.
smiling like for a long time.
And
people will wonder why are they smiling so
absolutely.
much.
I think I must say that it's going to retain the smile of the patient and the confidence.
It will make them want to smile, something to give them to smile about. Okay, that's really funny. And that's good as well. How long does this procedure take, and how long does it last?
Yeah, depending upon, when we do the whitening procedures, people, the patients, they always ask me, Doctor, how much is going to last? So the question I ask them is, so the amount of coffee and the amount of chocolate you consume, and then it depends upon how you are going to be taking care of your teeth after that.
Okay.
So you have to, being a dentist, I always say that we do not need to have any rough surfaces on the teeth. We just cannot tolerate any rough surfaces on the teeth. The teeth surface has to be very smooth.
Extra smooth.
Very smooth.
Okay.
Just to make sure that when it's a smooth surface, things are not going to stay there.
Right.
They're not going to be stuck there.
Right.
When we have chocolates, when we have tea, when we have coffee, when we have zarda, so their stains, they're not going to stay there.
Right.
So the most important thing is that they take care of their oral, the daily routine for their oral hygiene. You do the brushing, they do the mouthwash, they do the different procedures what we tell them. So that's how they will maintain the amount of the whiteness on their teeth for a longer period of time.
Of course. And I'm sure that after watching this program, so many people are going to spend so much time brushing their teeth properly now, because it really makes a difference when you hear it from an expert. And all the information that you've given, Dr. Awais, is so important, so informative. I've learned so many things here today. So thank you so much for giving us all your time right now and helping us to understand so many basic things. Just before we go, a message for our viewers, a short message.
Well, being a dentist, I always say that, the teeth, they are the most important part of your personality. So the amount of time you are on this planet Earth, you have the teeth with you. So when you have them with you, so you must take care of them. It's all the best.
Thank you so much.
Thank you for having me.
And that's all we have time for this week. Until our next episode, stay happy, stay healthy. Bye-bye.